going to tell us and give us some tips for caring for some of those people that have that loss and how we can really help them and become a vital part of the caregiving together, right?
Yes.
And we've got Conni Rodriguez. She's a doctor of audiology also, with the Topeka Ear, Nose, and Throat. And again, you're one of our new sponsors, and so we're glad to have you aboard.
Thank you. Thank you for
Thanks so
having
much.
us.
Well, hearing is just one of those things that can make you really socially inept almost, because you don't hear, or you become so quiet that you don't become a part or shy. And with caregiving, if you do not hear each other, that can become a little bit of a upheaval in the family life, can't it?
Exactly.
And with the professional caregiver. So you have a kind of an acronym for us that you're going to talk with us. So Conni, it's yours. You just take it away.
Well, I'm the type of person that needs something to help me remember.
Very
so
good.
That's why we've come up with this acronym that helps us organize the way that we communicate. The truth is that communication is really a complex process, and a lot of times we forget that. So just going back to basics to help us remember those little things that make communication easier, especially for someone who has hearing loss, making it a little bit more difficult to communicate with them than it has been in the past. So when I think about the best way to kind of ground us, to get us back to the basics of how to communicate with somebody who has hearing loss, I think of 4 different aspects, and we've organized them in an acronym that I call FACE. The first one, the letter F, probably the most important, and so that is, F is for face. Face the person that you want to talk to. Positioning yourself is crucial. The way that you talk to somebody, make sure you're in front of them. Make sure that they can see you. Make sure that your face is visible to them so that they can use those cues and help figure out what you're saying.
And even what your expressions.
Exactly.
Of your
Expressions,
face.
pictures worth 1,000 words.
Yeah.
Expressions goes
So
along
it all
right
goes
with that.
together.
Exactly.
Lots of times people that are completely deaf many times can read lips even, right?
Exactly.
So
there
it's important.
there are those lucky ones that can read
Right.
lips. So
Yes.
to see the person's face, positioning yourself so that they can see you when you speak to them,
Still
utmost
important.
importance.
Because
Now,
your expressions and your speaking and everything all go together,
all
right?
go together.
Yeah.
All go together. Now, the second part of it, and it's something that we sometimes forget, the A, attention. Make
Okay.
sure you get their attention before you start speaking to them. So often, when I'm asking somebody to do something, I'll just say, hey, did you remember this? Instead of first saying, Conni, I have something I need to tell you. Get their attention first. A 2-year-old, we can take examples from a 2-year-old who are always saying, Mom, 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 Mom.
Yes,
and they
constantly.
force you
Right.
to
look.
give them your attention. Third, C, clarity. Now, notice I don't say volume. I say clarity. Volume it's not everything. More important to speak slowly and to speak clearly. Make sure that you enunciate your words. So often you can help a little bit too by introducing the subject. Let the person that's listening know what you're going to be talking about. Fourth thing, eliminate background noise. We all know that background noise is a culprit for hearing, for listening. And so as much as you can, either remove yourself from the noise or remove the noise, whichever is easiest. So if we remember those 4 things, face the person, get their attention, speak clearly, and eliminate background noise, it can simplify that communication process and hopefully ease some of that frustration that comes with hearing loss.
And that is frustrating, isn't it?
Oh, frustration is part of the game, whether you have hearing loss or not. There's always going to be a time when you don't hear what you think you heard, or the person that you're trying to speak to is not hearing you. Frustration is part of it. But just remember, for the person who has hearing loss, it is just as frustrating for them as it is for you as a caregiver trying to communicate whatever it is you need to tell them. And it just compounds.
Yeah.
So just remember, frustration's part of it, but help them out. Help them out.
Help them before they get frustrated.
Exactly.
Because they probably
Exactly.
will be calmer then too. And
Usually
listen,
helps.
Right.
Usually
Yeah,
helps. Yep.
Yeah.
Yep.
Now, if you are a caregiver and you realize there is some real hearing loss, that's probably the time then to go and have that checked out, like we had talked about with Mary, right?
Exactly. Mary's exactly right. The first step in the process is an evaluation. What are we dealing with? Once we have that outlined, we can determine, with the help of your audiologist,
Right.
what the best process for rehabilitation is. Maybe that's a hearing aid. Maybe that's other assistive listening devices. Then it becomes the responsibility of a caregiver to work hand in hand with the individual who has hearing loss to care for those devices. We
Right.
know that hearing aids are not perfect. Like we talked about, there's going to be some frustration. But as a caregiver, the first step, make sure those devices are working.
Yeah.
And make sure those
Right.
devices are worn. A pair of hearing aids in your ears are loads better than a pair of hearing aids in a drawer.
On this.
Even if those hearing aids in the drawer we know are not perfect. I'll be the first one to tell you that they're not, but they're going to work loads better than one that's not even worn. So kind of encourage that. We recommend amplification in a lot of cases, but that goes hand in hand with wearing that amplification, and that's where a caregiver can come into play to help facilitate that.
Make sure that
Exactly.
they have them.
Yeah, make sure
yeah.
that they have them. Make sure that there's a battery in them.
Right.
Make sure that they get put in their ears because, like we said, it's not perfect, but
Right.
it does make
It's still-
communication easier. That's part of the process.
Sure. And is there, besides batteries, and is there a cleaning process or
Yep.
watching them carefully? Yeah.
And that's important. That will be instructed with your
Okay.
audiologist. And sometimes it may be important as a caregiver to make sure that you're part of those appointments so that you
So
can
you can
learn
hear.
straight from the professional how to care for these
Right.
things that do ease communication. So if you're not happy with the assistive listening device that you've decided to go with, whether that being a hearing aid or an amplified telephone or a number of other things, go back to the person that helped you with it.
Right.
Make sure you, first of all, have a professional that knows what they're doing. Exactly. And then have them help you in the process of caring for it, inserting it in your ear. And then if you don't like it, go back. Go back, and then go back, and then go back until you have something that meets your needs.
At the best that you can do.
Exactly,
Yeah.
exactly.
Right.
Because a hearing aid or any type of assistive listening device is a compromise.
Sure.
It doesn't correct hearing. There's still going to be that frustration. There's